Good evening, everyone. You're very, very welcome. Thank you so much for joining us at the University of Warwick Masters in Public Health and Health Promotion. It's such a pleasure to have so many of you here this evening. The running order for this evening is, first of all, we're going to talk to one of our very distinguished tutors on the programme, and that's Dr. Sadaf Leens. She's Senior Consultant at the International Association of National Public Health Institutes, and she is just a health system strengthening and transformation expert. She's passionate about public health and patient-centred healthcare. She's experienced working in the UK and the Middle East and leading multicultural and international teams, and is a member of the UK Faculty of Public Health and the Royal Society of Public Health. So she will be chatting to Dermot about what to expect on the programme. And then we're going to talk to one of our students and a new participant on the programme, and that's Dr. Wamaka Kaminyoge, and he's joining us from Liberia. And he is the winner of our student scholarship just gone. We're delighted to have him here with us this evening. And then we'll hand you over to Mr. Dermot Brannock, who's our Head of Academic Affairs, who will walk you through the full programme rollout, the curriculum and what to expect on the programme, and answer all of your questions in detail. Then we'll open the floor to Q&A. So I will just hand you over to Dermot to have a chat with Sadaf.
Brilliant, thanks so much, Rebecca. So as Rebecca said, I lead the academic function in iHeat. So I look after all of our programme delivery and manage the programme with the University of Warwick. So delighted to see everyone here this evening. We are going to do our absolute best to get this done within an hour. We sometimes achieve that, we sometimes don't. But Sadaf, it is extraordinarily late in the evening where you are. So do you want to just introduce yourself following what Rebecca said, and just give a small bit of background, and we'll have a chat about public health and the programme?
Yeah, sure. Thank you very much. I think Rebecca has given quite a nice introduction to my background. So I've been working in the field of healthcare and public health for now 23 years. And most of my experience was working in health system strengthening across acute mental health, trust, before I moved into public health. And the reason for moving into public health was I'd graduated through doing health systems and also in establishing the first academic health system on a national level in one of the Middle Eastern countries. And when we were looking at the models of care and constructing these patient-centered care models, we were also looking at how you prevent people from getting ill, so avoidable diseases. And that really got me into thinking about public health and how much impact public health actually has on creating wellness and health within populations. So that's where I started moving into, okay, so what does this mean from a systems perspective? And so my career has developed from there. And as Rebecca said, currently I'm working with the International Association of National Public Health Institutes. It's a very interesting time to be working on that level. Not only from the COVID perspective, but from also looking at the needs of strengthening and developing national public health institutes to reduce health disparities, inequalities, and inequities in populations.
That's brilliant, Sadaf. And I mean, I think what you're highlighting, one of the things that always fascinates me about your career is the number of areas within public health that you can both join from and go on to. That it is a reasonably broad area. And I suppose one of the things that I think people are always interested in is we've put an emphasis on health promotion in this master. So this is an MPH, but we put a very distinct emphasis on health promotion. Why is that particular angle within public health important, do you think?
Well, I think if you look at the way public health has actually developed, initially it was very much focused on infectious diseases and communicable diseases, because predominantly those were the diseases that would affect populations the most. But as time has moved on, there's been, change in communicable diseases being overtaken by non-communicable diseases. And that has led to the realization that actually 20% of healthcare meets the needs of people through curative models, but 80% of the health gains are to be made from non-curative treatments. And that is all driven through, lifestyle, behaviors, those kind of areas. And so they are addressed through health promotional programs. And we are seeing, things like increase within health literacy and the impact that that has. So health promotion plays now a bigger role within public health, and within changing the tide of, reducing avoidable diseases itself. So I think this master's and the emphasis on health promotion is very timely, because it fits within the needs of the population and fits within, improving the health and well-being of populations.
And certainly when we look at government strategies, and I'm based in Ireland, I look at the strategy that they're deploying for chronic disease management, where they want far more of it to be in family practice, and as you say, far more of a preventative model right up, and that's the same right across the Gulf countries. It's the same into Asia, into Australia. There's a drive to both enhance and improve patient care, but also to protect the health system by, as you say, not having a curative approach, but having, if you can have better health literacy, if you can have disease which is prevented in far greater proportion, then there are benefits to absolutely everyone in the system. In terms of I suppose of this program, then one of the things that I think is very unique about this program is the international nature of it, and that's everything from the faculty to the participants on the program. And when it comes, so we have a curriculum that is aligned to the Faculty of Public Health in the UK, but when it comes to the actual delivery of that, how do you see what do you see as the benefit of the kind of the international and the interprofessional mix of people on the program?
Well, I think that's the beauty of public health, really, in having that rich and diverse professional participation and contribution within the program itself. Because when you're working in healthcare, there are, you have your clinical professionals, you have your non-clinical professionals, but very much it's based around a hospital, or it's based around a primary care clinic, or a facility model, or a service. Whereas within public health, you have a very interprofessional and interdisciplinary relationship with people from all kinds of backgrounds. And, the students will find that really interesting in terms of learning from other people's experiences and perspectives on how to deliver public health services. That's whether you're working on a community level program or whether you're working internationally. And I think that's the beauty of, public health itself.
And how have you found that playing out in the tutorials that you're delivering each week? How have you found that mix and that interaction?
I personally love it. I like the different mixture of people's thoughts and perspectives coming to light. That it's very rich in terms of the discussions that we're having. It's taken a bit of while to get some of the people who come from purely clinical background to think more widely in terms of public health. And I think it's, dawning on them about how it is multisectorial in nature itself, and how the fact that you have to influence and develop relationships with different people from different sectors play a huge role in success. And so it's very interesting to see that change in perspective happening. And also, learning from each other's experiences has played out quite well. especially since we've got people from different corners of the world, participating in this master's program. It's, that's a really, really good thing. And it's a good experience for the students.
And just get conscious time, we could chat all evening, but what do you think are the career opportunities or benefits from doing a master's in public health? Because I think lots of people will be interested in the content, and lots of people will be interested in the learning experience. But when it comes down to it, most people will also have an aspiration to say, well, what does this give me? Where do I go afterwards?
Yeah, well, masters in public health is very science-based. It's very about creating the evidence to demonstrate how you're going to change the public's health. And I think, the opportunities that this opens up for anybody who works within public health are really, really broad. So you can work on a community level, within a small sector in developing, from urban planning, for example, and looking at how the social determinants of health impact everyday health and well-being of populations, to national level screening programs and design and developing and implementing early intervention programs, to the international level. So, working with NGOs like WHO, Gavi, all of these organizations, or any other NGO that has a real impact on humanitarian, on planetary health, environmental health. So, I could list all of these kinds of different careers that people could get involved in. And it's really up to the interest of the students in terms of which area they choose to pursue. But this master's will give them a really good and comprehensive understanding of public health.
I think you're right. And I think, it is, an MPH is it's the currency of how you move into this type of role. It is the kind of standardized baseline of, right, I've got this qualification and now I've got a passport to do, I'm interested, as you say, in international health. I'm interested in sanitation. Whatever it might be that you want to then focus in on. It enables you to do that. But Sadaf, I'm really conscious of the time where you are. So look, thank you so much for joining us. I think
Sadaf.
It's always really useful to get the experts' perspective. But I think let's hear from Waka now as a student on the program.
Well, Maka, just before you start, I was going to give you a little introduction as well, because you deserve it. Dr. Wamaka Kamanyoge is the recipient of our iHeat Health Impact Scholarship this year, and he is a very, very deserving recipient. During his career, Wamaka has been involved in implementing HIV treatment and care programs in low-income and limited resource settings, and is currently working as a TB and HIV lead in Partners in Health in Liberia. As a medical doctor, Wamaka has helped hundreds of thousands of people living with HIV and TB in low-income and low-resource settings. His work as technical advisor at HIV Care and Elizabeth Glaser Pediatric AIDS Foundation in Malawi is truly, truly inspirational. And we're really, really happy to have him here as a participant and student on the programme, just to give his overview and his experience on the programme. He's only started, so he's only with us a little while, just to see how he's getting on so far.
Maka, great to see you. I suppose the very first question I have is, you are a very busy full-time professional and a part-time student on the program. How are you finding the balance of professional life, family life, and study?
So I think that's a part where I'm really glad about the program, like the way it is designed. So like content is really easy, and like I go through not like the more content I can easily also just take out my phone, whether I'm waking, I'm like or waiting for something just in the corridors of the hospital. I just quickly take out as much as the time I take to just like read off Facebook posts It's just like that easy. I can take out my phone and just like go through some content for like 15 to 20 minutes and I move on. So I think that it makes it a little bit easy about that. But there's certain parts where I really have to dedicate time, like sit on a desk. But that would be like parts where you can actually like maybe an hour in a week, which is not much. So I feel like content is really accessible and much easy, and it's very part of my, like it barely puts a dent on my busy schedule.
Which is fantastic that you're managing to balance it with everything else. And I think one of the things that I'll show later on is the what the content actually looks like, and the fact that it is, the fact that it's mobile ready, that you can study this as easily on a phone as you can on a laptop or a computer is huge. And how are you finding the tutorials? We've heard from Sadaf, but how are you finding the tutorials in terms of the interaction with your colleagues, with your tutor?
Yeah, so like that's the other thing also. Like so, like again, like I'll usually be like a busy day, and at the end of that busy day, to sit in a classroom is always like very hard. Like very hard to like to sit through an hour and listen. So I remember my first one, I found that was quite easy because it was mostly like a discussion, and also it was because like most of the content is like more like you've gone through it and you're quite familiar with it. But you get to listen to about all of your other colleagues, and it's like a very different type of workmates or like colleagues are like in a totally different setting. So it's always interesting to hear about what they think about certain, or they talk about, like they give us examples about what's the biggest burden in the country or where they're working. So it makes it really interesting and it's very engaging, and the tutor and the facilitators will make it very easy for us because they keep like asking us questions and being very interactive. So the whole session it's really not as a didactic learning session, but it's more exciting and interactive.
Yeah, I think that is very important, that it's not a, when you come together as a group, that it's not somebody giving you a lecture for an hour, that it's interactive, it's discursive. Yeah. And, Sadaf, what sort of techniques do you use to draw things out of the group and make it a safe space for debate and discussion?
Yeah, so during the week we have a discussion forum. So a question is posed. It's usually, around a hypothetical case study, for example. And then, that starts the conversation between the students, and the tutors, provide some answers. So I will look at what the discussion says. And then when we go into the tutorial, there'll be a little bit of a chat about that discussion. And what I like to do is present some of the overarching things that were learnt during that week. Yeah. But then I will bring a case study into it. And that will lead on to questions that I will, ask the group, say, okay, so what do you think about this? What are your views about it? So for the session around burden of disease, it was around, well, if you are looking into something, then how would you approach this? How would you go about it? And that leads to a really interesting exchange. And then at the end, I will say, okay, fine. So these are the things that we've all touched upon that are correct. Further to this, these are the things that, you could be thinking about or could be considering. So that's how I try to make it, a more interactive thing, rather than going through, well, over the past week, this is all the things that you have learned, because I don't see the point in doing it that way.
Yeah, exactly. And I'll be showing the platform later on, and that's where you get the content. The richness, though, is where you have the discussions with your colleagues, yes, for sure. And Wamaka, how are you finding the level of guidance and support? As Rebecca said, you're about a month into the program now, so it still must feel new. How are you finding the adaptation to studying, and the guidance and the support that you're being given?
Yeah, so I find I think it's really, really good. I mean, it almost feels as if like Croda is, I think that's the most, like we interacted quite a lot, and like I feel like almost any question I would have, like I can easily just email and I'll get a response. And it's also nice to always get those reminders, as well as if like other classmates are asking something else and should like immediately like tell us exactly what most people are asking and what's the help coming in. So like before you even ask, you almost already get your support and answers you would ask. So it's really top notch, I should say.
And I think you've hit on something really important there, which is the team that manage the program have, you know, years of experience in education management, and they, between them and the tutors, there's an element of predictability about where people will need support, where people will need guidance, and how to best advise them on, you know, next steps and what they should be doing, and really to make sure that everyone kind of moves along and gets through the program in the right amount of time and with the right support. And the last question I was going to, well, two last questions, Warick, if I can. One is, how have you found the relevance of the material that you're studying to your professional work? And the last one is, you know, what guidance would you give anyone coming onto the program?
Yeah. So yeah, I think the material is really relevant. Like so far, I've only had like not quite a lot, but yeah. But as far as what I've heard, like like right now we're going through communicable disease, which is like very like 98%. The other one that we went through the course was about environment, and this is something that we've been hearing about it on the news, about what's going on and everything around us. But it was really very interesting for me actually to learn, you know, more about it. So it wasn't like it was very quite relevant to what's happening today. And I also like how about there's always mention of COVID. So I think it really shows that the content has really been updated very recently. Because there's several things that we're learning that I could have seen but may have not forgone as important. But now I'm like really understanding about like how this was going on, and I really understand the decisions why they made and why were they made that way. So it's really quite relevant, and I think it makes me a better program, I should say, as of now. So it's really, I think it's up to date. But we've only had 3 courses, so I'm yet to see the others. But yeah, I'm quite interested. I'm quite curious to see what else is there.
That's fantastic, and I'm looking at Sadaf smiling because she authored the content that you're going through at the moment. So it's nice praise to get, Sadaf. And actually, Sadaf, if I can finish with you before I move on to the presentation, why do you think? I'm sure there's going to be people on this call that are already working in public health, but I think there's equally likely to be people that are not and that are considering pivoting into a career in public health. From a personal perspective, where do you get the reward from being involved in public health?
Oh, that's a really interesting question. Thank you. Okay, for asking that. I'll have to think about it. Actually, I mean, the satisfaction, as I said before, I've always worked in healthcare. And so my career, or the beginning of my career, was about treatments and curative models and, you know, making patient-centered experience services work and introducing efficiencies. But what I get out of public health is knowing that what I am doing is focused on reducing health disparities in populations. And those people who need health the most are those who are benefiting from public health programs. So preventing people from getting ill and staying well, that's really, for me, the biggest reward that I get.
I think that's such a valuable way to look at it, because you're right. If I go back to what I mentioned earlier about chronic disease management, it disproportionately affects people from lower socioeconomic backgrounds. It disproportionately affects people that have poor health literacy, and therefore the scope to positively impact public health initiatives is huge. It's enormous. If you can get that right, you can, as you say, you know, you're not treating individuals, you're treating entire swathes of society, which, yeah, the feeling you'll get from doing that is extraordinarily positive. Okay, Womaka and Sadaf, thank you so much for your time this evening. I'm really conscious of time, both for yourselves and for the presentation here. So what I'm going to do is thank you both for your contribution. It's brilliant to get you know, the people that are actually involved in running and being a student on the program to get that perspective. So what I'm going to go into now is a presentation of the structure, the logistics, the eligibility, the platform, and all the nuts and bolts of what it's like to be a learner on the program. So thanks so much, Sadaf and Womaka, and hopefully everyone can now see my screen. Yeah, brilliant. So one of the things that you'll notice about the program is you'll see the University of Warwick, and right beside it every time you will see iHeat. The University of Warwick need less of an introduction than we do, but iHeat, effectively, we're an Irish company. We were founded by a family doctor in 2013, and really we were founded as a result of what started off as individual projects and then groups of people doing projects turned into much larger work with healthcare ministries, both in the UK and Ireland, and particularly across the Gulf and into South Asia. And what iHeat do is we're healthcare education specialists. So we bring qualifications from prestigious institutions like the University of Warwick, like the Royal College of Physicians, to a global audience. So the expertise that we have is in online learning design, in program delivery, and in student support. So on our online platform that we use with all of our institutions, we've had over 400,000 course completions since 2013. And that is everything from short CME programs to professional diplomas, to master's qualifications, to family medicine residency programs, you know, catering only within healthcare, but to a very broad interprofessional mix within healthcare. So we have partnered with the University of Warwick to develop this and a number of other master's programs. Warwick need far less of an introduction. They are one of the top universities in the world. They are ranked 8th in the UK, they're 62nd worldwide. They're a member of the Russell Group in the UK, which is the top research-orientated universities. The campus-based Masters of Public Health that Warwick have is ranked 3rd in the UK. It's ranked 10th globally. They are an absolute powerhouse when it comes to public health. They have such an amazing reputation in it. They do a lot of research, and they do a lot of international work in public health. And Warwick has strategic alliances with universities all over the world, from Australia to the US. So I think what is important, though, is the program is accredited by Warwick as it's level 7 in the UK, which is the equivalent to level 9 if you're in Ireland, and it varies by country. But effectively, it's a master's qualification. And one of the questions we always get asked is, is the qualification any different from other Warwick programs? And the answer is no. The certificate that you get at the end of this program is the exact same as any other certificate that Warwick would issue. It doesn't mention online learning, it doesn't mention distance learning, it doesn't mention iHeat. It's simply a Master's of Public Health and Health Promotion from the University of Warwick. So what I'm going to give you, I think, a flavor of this evening is, this program, it's based on kind of academic excellence is at the heart of it. It's got the most amazing online learning environment that is, it's created by world-leading experts in public health, by world-leading instructional designers and software engineers. And, the quality of it is phenomenal. The international piece of the program, I think, is very important. If you're studying something like public health, having a very homogenous class where everyone's from similar backgrounds with similar experiences, that doesn't expose you to the range of debate and discussion that you can have on an international program. So what you'll see is we group our student groups broadly by time zone. So if you're in the European group, which I suspect some people on the call this evening will be, that will be UK, Ireland. It'll also be Africa, South Africa. It'll be as far as kind of the west of the Middle East, if I was to say it, you know, kind of +2, +3 hours from GMT. You can group all those different nations together and have a really, really broad range of experiences and backgrounds, but still construct a timetable that works for everybody. So, you know, that is really important, the international, interprofessional piece. As is, though, we've designed a program that should feel very authentic, very lifelike, very practically focused in terms of the types of assessments that we'll ask you to carry out and what we'll ask you to do. And then the piece underpinning all of this, and some of my colleagues are on the call tonight, is the support team around the program. So there's a huge amount of support provided to you as a learner in the program. There's always somebody there to guide you, to respond to you, to give you support when it's needed. In terms of the people that are contributing to the program, yes, they come from Warwick, but they come from other UK universities. They are, you know, Tim is a leading light in the BMJ. Staff is with the International Association of National Public Health Institutes. Katie Reid ran the University of Manchester's incredibly well-regarded public health course for almost 2 decades. This is, you know, 6 of a very, very broad team, which has an emphasis in the UK, but we've also, you know, we've got a professor of public health and epidemiology from Beirut, from Abu Dhabi, from Monash in Australia. You know, we've got there's an extraordinarily large group of contributors in the program. So the perspective that you're going to get will be expert, but also will be varied. It won't feel like a very kind of siloed orientation to the curriculum. It takes a very global perspective on public health. So in terms of actually what you cover, we break the program into 3 semesters. And the first semester, which is the postgraduate certificate level, this is kind of the basic sciences. And what this is enabling you to do is kind of explore the science behind the spread, the control of disease, environmental impacts on human health, how kind of policy and data can transform the health of populations, and really give you kind of a very solid grounding in the principles of public health. So each of these modules is 6 weeks long each, and what you'll see is each week has a particular topic. So if you're on the program now and you're in Communicable Disease Control in week 4 of module 1, you focus on that for a week, and then you move on to focusing on public health policy. So as a part-time program where everybody is a full-time professional, with, you know, a family and everything else, having a very, very structured approach, it allows you to segment your time, it allows you to plan, and it allows you to engage really well with the content. So you go through these, so you've got 6 weeks, you've got a break, 6 weeks, a break, 6 weeks, a break, going through the content, and you can see the type of introductory approaches to public health that we're doing. One of the things that we're often asked is about the evidence-based approaches, which looks at epidemiology, looks at statistics. And for people that aren't mathematically inclined, what I would say is, do not fear this module. It is about the analysis of data. It's saying that, you know, and we've all seen COVID data over the last 18 months coming out of public health bodies. And it's about being able to look at trends. It's about being able to look at forest plots. It's about being able to analyze something that is published without the need for someone else to interpret it. What it's not doing in this module is getting you into the bowels of SPSS statistical software and getting you doing really complex calculations. It's saying that when you're presented with something, can you look at it and say, well, what does that do for the number needed to treat? What does that confidence interval mean? So it's a very practical, applied interpretation of data, as opposed to, at this stage in the program, compiling that statistical data yourself. And then obviously, you know, we've seen over the last 18 months the influence of politics and society on health through a pandemic has been, it will make for many fascinating theses over the next few years, I've no doubt. The second semester then that we move on to is what we call, this is the art of public health. So it's looking at health promotion, it's looking at international health, it's looking at health policy and economics. And these are some of the most contemporary areas in public health that you can study. And you'll learn how the conditions in the places where people live and learn and work and grow can affect their health outcomes. You'll learn how public health professionals collaborate in all of these different areas and build interventions and design things around, as Sadaf said, urban planning, around mental health interventions, around chronic disease prevention. So it's really, if module 1 is teaching you kind of the core science, module 2 is really teaching you as a public health practitioner, how can you implement this in your locality? How can you influence, either on a very local, a national, or an international stage? How can you positively influence public health? And then the same model again, of these are 6-week modules. They have breaks between them. There's reading weeks within them. So a very, very well-paced structure in the program. The third module, or third semester then, is where we get into research in public health. And public health professionals, again, the last 2 years have shown it, they're at the forefront of research and practice and service. And that's everything from nonprofits to community organizations, to education, to government, to private industry, to healthcare, you name it. Public health research is at the heart of it. And again, we've seen masses of outputs of public health research through COVID-19. What we teach you in this module, so there's 2 parts to this module. The first is an 8-week taught module on research methods. So we teach you how to choose an appropriate research idea, how to read around that area, decide what the best methodology to answer that question is, develop your proposal and get it approved and get the ethics sorted, and then data collection and the analysis of that data, and then the writing up of the manuscript. And I think this is where Warwick are particularly innovative, that they do not ask you to do a 15,000 word dissertation or thesis. They ask you to do a 4,000 word journal article that should be ready to be published. The end goal of the master's program is actually something that you can take away and hand to a publication to say, this adds to the body of knowledge in public health in whatever the area is that you're interested in. And the second piece then you can see is a conference poster presentation. So you do a conference poster and you present it. So the output of the masters is very, very practical. And then, so as you go along, how this works then is we give you a really comprehensive online orientation. And that gives you everything from the program structure to regulations. It gives you the supports that are there and really makes you comfortable with everything before you kind of get into week 1. Each week then follows a pattern. And Sadaf spoke about this a few minutes ago, where we'll start with a discussion forum that you complete in your own time. And we then move on to you going through the online content related to that particular topic. And this is what Wamaka was referring to, that the content is exceptionally visual. It is really, really interactive. All of these little nodes here are clickable. It doesn't feel like you're studying. It feels like you're just reading something that's really interesting to you. It's full of animation. It is mobile ready, so you can study this as easily on your mobile as you can on a laptop or a computer. It's very, very interactive. And I suppose what it's not is, it's not flat text. It's not PDFs. It's not PowerPoints or little short video animations. You know, it's got contributions from world experts on video throughout it. So the quality of that online experience is amazing. So you go through the content for that particular week in your own time, you contribute to the discussion forum, and then towards the end of the week, you've got your live tutorial. And that's where you come together with your group for an hour to discuss that week's content. And, you know, we assume you've gone through the material. So really what that hour is doing is bringing the content to life, discussing how applicable it is in your situation. And that will differ depending on where people are, depending on the resources available to them. So really it brings the content to life and makes you feel part of a peer group. And you know, the fact that the weeks are bookended either end with, you know, you have a discussion forum at the start and you have a tutorial at the end, it constantly makes you feel that you're part of a group, that you're not learning alone, that you're not on this journey in isolation. There's a group of like-minded people with you. And then, you know, the assessment is fair and very what we call authentic and practical. The assessments will ask you to look at what public health guidance and literature says and then design something. So, you know, if design a public health intervention that could work in your area, they tend to be very, very applied assessments. So, you know, the structure of the program feels like that, but actually, what does it feel like to go through it as a learner? So we have absolute caps on the numbers on this program. So, you know, Warwick is a really, really prestigious university. We keep the group size small. We keep the support level very high. So we've got about 20 people in each group with a world-renowned tutor for each module, and you have a different tutor for each module. So you get to know your group very, very well. The pace of the taught modules across semester 1 and 2, that's 6-week taught modules with reading/writing weeks and with breaks between them. That works really, really well. And it's a well-honed model, and what we're absolutely confident of is you can manage this with a clinical or whatever your professional workload is. So, you know, this program is designed from the outset to be online. It's designed to be fully online, as opposed to something that was previously face-to-face, that thanks to COVID, you know, people have put up PowerPoints or, you know, turned it into an online course. The DNA of this course is that it started as an online program, and that everything we do assumes people are part-time learners, full-time professionals, and they need accessibility to everything and a huge level of support. So the supports that are available in the program are absolutely fantastic. You've got you know, the program leaders see you regularly, your tutors you see every week, you see someone from the course management team every week, there's technical support there, and you know, that all of that comes together into a really, really coherent kind of package of a learning offering. And when we look at, you know, feedback from our students on this and on our other Warwick programs, so we've put, actually it's well over, this slide is slightly out of date now, it's well over 600 or 700 people that have gone through the Warwick programs in the last couple of years. We've 96% student engagement on this public health program. We have the survey that we did last week with the current group, 98% positive on program support and organization, and 92% are likely to recommend it to a friend or colleague. So, you know, there's a huge amount of goodwill, there's a huge amount of positivity, there's a huge amount of advocacy coming off this program. And, you know, the people on the program, they're from a really rich background. You know, they're doctors, they're nurses, they're pharmacists, they're in community welfare, some of them are in the charity sector. So, you know, there's a huge amount of variety, and we keep going back to the richness of a program like this comes from the mix of professionals on it. And you can see some of the comments that they made, and they're all taken from the survey last week. And, you know, what they speak to is organization, quality of materials, quality of delivery, the prestige of Warwick, and it's a very kind of positive space to be in. So in terms of some of the practicalities then of how to join the program. So the entry criteria, very straightforward. You need an honours bachelor degree from a recognised institution, which is a university. So you also need you need to be able to complete the program that's being conducted through English. You're not subject to a formal English language assessment because you're not coming to the UK. You don't need a tier 4 visa, therefore you don't need to have that in place. However, you do need to be able to competently write through English. So we will assess that through your personal statement. We will assess it through the conversations that you have with your education advisors that are guiding you through the application process, and they'll make a determination. We then have, we will ask you for your degree transcript. We'll ask you for a letter of recommendation from either an employer or an academic, and we'll ask you for photo ID. And that should obviously not say October, apologies. In terms of the fees then, so the fees, again, very straightforward fee structure. The price of the program is £12,000. There are, until the 17th of December, there are a number of reductions available to you. They're quite significant reductions. So if you go for semesterized payments, which tend to be slightly larger payments, and you register early, that the price of the master's goes down to £10,000, which is a very large reduction. Similarly, the postgraduate diploma is £8,000. There's a very substantial early registration discount, and then an early payment one as well. There are lots of options as to how you can then pay the fees on the program. You can pay up front, you can pay by semester, you can pay by month. It is eligible for student finance in England and Wales, and probably Scotland and the Isle of Man and others as well. But Student Finance England and Student Finance Wales are probably the two main ones that people utilise if they're in the UK. So, and the program, as I said, there are limited spaces on the program. We keep the ratios of tutors to participants fixed, and this, this program, the 3 groups that we put on in October, they were full. And we fully expect the next intake to be oversubscribed as well. So the way the spaces are allocated is effectively the people that pay their deposit and fill in their application, give us their documents first, they get the space on the program. So just coming to the end, and I can't see the chat here, so I'm not sure if there's lots of questions or not, but effectively the program, what you're getting from this program, it's a very prestigious award from a top 10 UK university. It meets the academic requirement for a public health consultant. Obviously, there's a training requirement that goes alongside it. If anyone is looking at the Faculty of Public Health examinations, it is aligned to the curriculum and amazing preparation for that. And there's transferable skills as well. With any masters like this, what you get is a skill in critique and appraisal and synthesis and research that's relevant to any career option that you have. So, what we're looking at then is a 22-month master's program, which is split a postgraduate certificate for 6 months, a postgraduate diploma for 6 months, and then a master's for 10 to 12 months. The award from Warwick is phenomenal. The level of support in the program is absolutely phenomenal. What's really hard to get across in a talk like this is actually how fun it is, how engaging it is, how the quality of the platform and the quality of the content really enables you to learn and develop and enjoy it with peers. And most of all, it is fun, it's enjoyable. So Rebecca, I'll stop the screen share here and see what's come up on chat. What haven't I dealt with? When in the day are the tutorials? Yeah. So Sarah, everyone is working full time. So there are tutorials on a Thursday evening. So about 7:30 on a Thursday evening UK time is a tutorial that tends to suit the European audience. Then there's a tutorial at 7 a.m. UK time on a Friday morning. That tends to suit people that are in the Gulf and people that are ironically in Eastern Australia, where it's 6 o'clock in the evening. And then there's a tutorial late morning, about 10 or 11 o'clock UK time, which tends to suit people. It's after prayer time in the Gulf, suits Malaysia at 6 o'clock in the evening. So we've constructed timetables that work for an awful lot of regions. So the tutorials, everyone's working, and we assume everyone's working. So you're able to attend. You're facilitated to attend by a timetable that's designed around part-time learners. So the tutorials are also recorded, and that's really important. That everybody will miss a tutorial at some point. If you miss it, the recording will be up there within a matter of hours afterwards. Along with what's a really useful feature is the transcript is also recorded. So if somebody is talking about a particular topic midway through a tutorial, you can actually just search by text and it will bring you to when they were talking about it in the tutorial. So the technology is phenomenal. What else have I missed on chat, Rebecca?
It's been quiet enough tonight. Sometimes it's nothing but chat, but tonight it's quite quiet. So yeah, I think any of the questions the guys have asked as they've been going along. So it's some nights you just can't stop the chat. Today has been very, very quiet, but hopefully that's because yourself, Sadaf and Wamaka, answered any of the pertinent questions that anybody has, or you're just shy, one or the other. But I will say, just to kind of summary, that you will be getting a recording of this webinar if you joined us a little bit late, and if you missed either Dr. Sadaf Lyons or Wamaka, one of our participants. If you did miss their interaction or some of Diarmaid's presentation, we will send you the recording to you by email tomorrow. And you will also get a link to apply and a link to pay your deposit if you do choose to progress on the programme. So as I said, the forthcoming intake is coming up in the beginning of March. It's coming soon and fast, and places are filling fast. And as Diarmaid alluded to, we do have caps based on the time zones that you're in. We have a cap of 30 per region. So they do fill quite quickly, just to let you know. So if you are interested, we would urge that you progress. And in Diarmaid's fee slide, we do have that significant discount, early registration discount, if you pay your deposit before the 17th of December. So that is significant, and we do urge you to go ahead and progress to deposit payment if you want to secure that reduction.
So yeah, I think it's an incredibly enjoyable program. The faculty on it are absolutely world class. It's the topic area and the A to study, but B, the career options that a Master's in Public Health gives you is absolutely phenomenal. So I think, of all of our programs, it's probably got the broadest appeal. That results in a lot of interest in it, which is fantastic. And yeah, so it has been brilliant to see everyone this evening. If there are questions, reach out to the education advisors after this. As Rebecca said, you'll get all the information tomorrow, as well as the recording. And we really hope to see lots of you on the program. So thank you very much.
The education advisors will be reaching out to you by phone. So if you see a UK, a +44 number that you don't know where it's coming from, coming on your phone, it will be our education advisors reaching out to see if you enjoyed the webinar, if you have any other questions, and if you want to progress to application.
Thank you so much, everyone.
Thanks, Diarmaid. Good night. Take care.